Good morning. I'm going to say this again. Everyone needs to stay home unless you are going out for essential reasons. Every time you leave your house, you put yourself and everyone in your household at risk. This includes everyone you come into contact with too, your family, your friends, and your neighbors. This week we have people celebrating important religious holidays like Passover and Easter. I'm asking you to observe these holidays with the people you live with. You can save your life and their lives by staying home for these holidays. I have spoken with faith leaders across the city over the last week about the need to stay home for these holidays. I have seen churches and synagogues and mosques throughout Baltimore finding new ways to worship and pray together while social distancing. It will be hard for many of us to celebrate these holidays without being around family and friends. But staying home this year will literally save the lives of some of those loved ones and allow us all to celebrate together next year. On a brighter note, I'm happy to announce a partnership that will allow many of Baltimore's children and families to receive diapers despite the challenges we face today. This partnership between the Health Department and Share Baby will see nearly 500,000 diapers delivered for Baltimore residents over the next couple of months. Now I will turn it over to our Health Commissioner, Dr. Letitia DeRosa, to provide additional information on that partnership.
Good morning. Thank you, Mayor Young, for your leadership, and thanks to my colleagues and our partners for their support. Today, I'm joined by Amina Weiss-Kerger, the Executive Director of Share Baby, a Baltimore-based nonprofit. I am pleased to announce the partnership between the Baltimore City Health Department and Share Baby. We will be distributing over 500,000 diapers to 10,000 vulnerable children and families across Baltimore City. This emergency distribution is made possible by purchasing of the diapers by the Baltimore City Health Department with funding from the Maryland Department of Health. Additional operational support is being provided by the Annie E. Casey Foundation, as well as emergency relief grants from the Baltimore Community Foundation and the Able Foundation. We know that children and families with limited access to clean diapers and basic necessities are disproportionately impacted during the COVID-19 pandemic, and that prior to the outbreak of the COVID-19 pandemic, 1 in 3 families in the United States struggled to have enough diapers to keep their children clean, dry, and healthy. Now we have seen the number of families seeking support from diaper banks skyrocket. It is our hope that this partnership will provide some comfort for families in need during these difficult times. Beginning on Thursday, April 9th, and continuing for the next 2 months, our partnership will deliver diapers to families across the city through a distribution network of local partnering organizations. Again, I would like to thank Share Baby, the Maryland Department of Health, the Annie E. Casey Foundation, the Baltimore Community Foundation, and the Able Foundation for their contributions and willingness to step up to assist Baltimore City families in need. Thank you.
Thank you for sharing that news. I know our families who are struggling will benefit from this great work. Next, I would like to invite our Director of Recreation and Parks, Reginald Moore, to talk about his department's new initiatives.
Good morning. We're excited on behalf of Baltimore City Rec and Parks to introduce what we're calling virtual recreation centers. We know that the community has been wanting to get outside. They want things to do for their kids. And so what I challenged our team was to create a site where we can still engage and have fun with families and kids, but in a safe manner. And the way we can do this is by having people visit our site at bcrp.baltimorecity.gov/virtual-rec. This site has been active today. On this site, people will see information such as things as gardening tips, STEM activities, outdoor fitness opportunities where you can actually have workouts in your backyard. But we have to continue to stress that if you're out in our parks are still open. but you continue to practice social distancing. Some of the challenges that we're continuing to see is that citizens using the playgrounds. The playgrounds are closed. Our outdoor courts are closed. So we're encouraging citizens, please, to help us in this manner and keep your kids off of these play structures. And that is why we're creating this virtual recreation, so that you can continue to have fun for your kids. So we're really excited about it. But this site is active, and we encourage everyone to go out and take part and have fun. Thank you.
Thank you, Director Moore. Really appreciate Rex and Parks going over and beyond to do what they need to do. These programs will help our youth and families continue to stay active and engaged while staying home. Lastly, I would like to announce some good news coming out of our artist community. A group of 20 artists and art organizations have created the Baltimore Artists Emergency Relief Fund. These funds will provide financial assistance to artists and creative entrepreneurs living in Baltimore. The fund, like many others at this time, our art community is suffering economically due to the impact of this crisis. Our culture community keeps Baltimore vibrant and creative with visual arts and performance that inspire and uplift us. And arts and culture in Baltimore is responsible for providing more than 15,000 permanent full-time jobs and countless more part-time positions, while generating more than $42 million in economic impact. The Baltimore Artists Emergency Relief Fund will provide approximately 250 grants for artists living in Baltimore City. These grants will be for $500 each. The financial contributors are T. Rowe Price Foundation, the Baltimore Office of Promotion in the Arts, the Maryland State Art Council, the Grit Fund, and Baltimore Creative Acceleration Network. Artists can apply online at the BOPA website, promotion/art/arts/dot/org. Additionally, if people would like to donate to this fund and help local artists, they can also go to promotion/art/arts/dot.org to donate. Now we'll take a few questions.
Mayor, some cities, including New York, are going to start presenting on their own data, demographic data, zip code racial data about the folks who are been infected with coronavirus. Why? Will Baltimore do the same thing?
Well, we've been asking from day one for this information. As you know, they have private labs that are doing testing, and the state also was doing testing, and we really didn't have that information, but we have asked, but I'll defer to Dr. DeRosa to explain further, but we're no different from anybody else. We asked for that information, but the state has it, and private labs.
So as a part of the public-private partnership, we do have a resource dashboard stream. So we are actively working to collect the data that we receive from the state and create a dashboard that will be internal and external facing for the public.
The population of Baltimore City ranks about 62% African American. From what you know at this point of the 500 and some cases that are confirmed, does it follow that percentage, or does it look to be over?
So again, we at the local level aren't necessarily collecting the race data. That really is collected at the state level. So we'll be working with the state as well as CRISP, who houses the Health Information Exchange and does have the racial demographic data, to ensure that we can share that information more publicly.
Are you as concerned as shared now nationally about the disproportionate burden of this disease on the African American population?
I think we were always cognizant of it, recognizing that, again, we are a city that is 60% or so African American, and that we do have a number of health disparities that exist among our population. That was always at the forefront of our mind, that there would be disproportionate effects on that community.
Do you know, in terms of the fatalities, the smaller number of cases, how many, the racial breakdown of those?
So again, we don't necessarily collect that data. We learn about death data, again, from the state. So the Office of the Chief Medical Examiner provides us with that information.